Good morning. Good morning. I'm Renee Pratt, Director of Metro Social Services. Thank you so much for coming this morning. Before we get started, I'd like to acknowledge a few people in our audience. Mary Rolando, Chair of the Social Services Commission, Betty Johnson, Board Member of Social Services, Kim Johnson, Board Member of Social Services. We appreciate you coming today. Also, if you're an elected official or running for election, please stand so we can acknowledge you as well. Thank you. We appreciate your interest in today's CNE. It continues to contain social, socioeconomic, and demographic information relevant to Davidson County. This year's CNE contains food and nutrition, health and human development, housing and neighborhoods, aging and disability, work and economic opportunity, and evidence-based practices. We feel that this information is very helpful and can be used by public and private organizations. Metro Social Services last year used the data to improve our programmatic issues as well as our organizational issues as it relates to customers and the customers' needs. So we hope you find this information useful and you enjoy the event today. I would like to take this opportunity to introduce our research advisor for the Community Needs Evaluation, Dr. Oscar Miller, who will describe the importance of using data to make best practice decisions. Dr. Miller.
Thank you, Executive Director Pratt. Good morning.
Good morning.
Okay. So I'm to talk about having and using data to guide services and policy. Now, I've done this presentation several times, and it always seems like I'm talking to the choir because I know you all out there use data quite often, but there's always a few in the audience who may not use it as much, may not understand how important it is to use. So I just wanted to start by saying or describing a situation where you might not use data. And for me personally, I'm thinking more of informal situations. So when I communicate with my wife, my best friends, or longtime co-workers, I communicate in a language that's far more relaxed than I try to do today. I use words that hopefully I don't use today. And I use phrases that hopefully I won't use today. And I'm very relaxed, and I have time to communicate that thought that I may have. The reason this is possible is because I have developed some level of trust with that audience, my wife, my friends, my coworkers, that has developed over time. And so I can say things, I can make mistakes in my communication to that audience, and they are very forgiving. They cut me a little slack, and they understand. They're engaged because of who is speaking, because I'm speaking. Conversely, when I try to communicate to a different audience, an audience that doesn't know me at that level, who I have not had the opportunity to converse with over time, I have to use a language that's more universal, a language where you didn't have to grow up where I grew up to understand. Okay? And so that language to me is data. So I use the language of data when I communicate to those types of audiences. So the gist of that is that having and using data is fundamental to facilitate success in our endeavors, in our workplaces, our projects, everything that we do in a more formal setting, and particularly in our advocacy for poverty reduction, affordable housing, and in creating a more equitable and inclusive city. The further away I get, and I think we all get, from the familiar people who have a lot of experience with us, the bigger the ideal we're trying to communicate, the more important it is for us to use that universal language so that everyone understands what we're talking about and we can move forward on that basis. When thinking about doing this, I tried to come up with some gimmick, and it's not going to work, so I'm not going to do it. But I will tell you about it. The gimmick was I thought of an auction and how, since I'm not one who goes to auctions, I really don't understand what the auctioneer is saying. I did hear the hibbida, 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 and they do that 4 times as fast as that. And so I looked at over the internet and when I thought I could do this, and to get some more information, and learned that the only important information that the auctioneer is trying to convey is what's the current bid and what's the next bid. All that other discourse and talk is just filler. They could care less. And the audience could care less as well. Apparently, it gives them time to think about what they're doing. So, given that the only piece of information there is that fact about the current bid and the next bid, I want you to think about that analogy. When you're talking to these people running for election, those in election, imagine their day, how it starts out. People are coming at them. People who may be saying the same things to you, people may be advancing opposing views. They're coming at them all day long. At the end of the day, I can imagine walking up to them sounding like hibbida, hibbida, hibbida. Yeah. But if I have some data in my hand that is concise and that I can even provide to that decision maker, I think that would have a lot more impact to kind of drown out the fog that we create as we all try to sell our ideas. And so I wish I could have done that analogy like I wanted to, but I'm sure you're glad I didn't try. Okay. So, like you, I have used data in my personal work. As a teacher, I use data to modify my lectures, to hone some part of a presentation, to change a test or something like that, all toward the goal of improving learning in the classroom and even outside the classroom. So I'm sure you've had that experience in your work. I also would like to think that my work in the community to look at things like barriers to employment for ex-offenders or race and ethnic fairness in the criminal justice system have produced some data that could be used for changing policy and developing improvement strategies. The one that I'll share with you that I like to share most is my involvement in a project that was led by Dan Cornfield, who I'm sure many of you know. He's a professor at Vanderbilt University. He convened a team, a multidisciplinary team, a multi-university team of researchers to develop a community, a immigrant needs assessment. And I believe that was the first ever immigrant communities assessment in our city, or at least to my knowledge. That data allowed us to go against some conventional wisdom. That wisdom was, and part of it was based on parochial data, and by that I mean data that came from the agencies themselves. And the data stated, and the wisdom stated, that we have enough services to serve the immigrant population in Nashville. Our data confirmed that, but it also showed that the data were not accessible. They were not located in places where the immigrant populations could access them. the services were not available in places where the immigrant populations could access them. So by having that data, using that data, we were able to get that conversation going and affect some policy, affect some changes in where these services were located. And so that's why it's important to have that data. And I'm about done because I know my time's up. So. I just wanted to conclude by finding where I need to be, by thanking Executive Director Pratt and Director Gregory and her team for the vision they had to start this community needs evaluation and to keep it going for so long. It has become a very important document for me and many of my colleagues who use it regularly. It is the conversation, and indeed it's become a story of part of Nashville, part of where we live. So I want to congratulate them and thank them for that. Now, I would encourage you all to use this document for your own personal, professional uses, but also use it as a benchmark to move our entire community forward. I can think of no better thing than to hear, as we continue in our work, the chorus of according to the community needs evaluation. If we do that, we can talk to one another from miles away. We can bring new people into the fold and have them immediately engage in the same conversation. We can move our community forward and have information that allows us to assess how far we have yet to go and how far we have come. So again, I want to thank them and thank all of you for being here and listening. Thank you.
Thank you very much for being here. I'd like to begin by introducing the people that you'll be hearing from during the first part of this event. I'm Dinah Gregory, and I'll be talking about social, socioeconomic, and demographic data, poverty data, and local studies and information that we've gathered here in Nashville. Next, you'll hear from Julius Witherspoon, who will first speak about aging and disability, and then speak about food and nutrition. Following him will be Joyce Hillman, who will speak about health and human development, then Lee Stewart on housing and neighborhoods, and Abdul Ghani Barre on workforce and economic opportunity. I'd like to tell you a little bit about why we do this community needs evaluation each year. We analyze and collect and try to find the data that will be most helpful to the people who provide health and human services, social, health, different kinds of services. And it helps them understand more about the people they serve. In fact, it's kind of a market research for the clients that need services. We also provide specific information about the issues that I just mentioned, complex factors related to poverty, existing and projected unmet social service needs, and evidence-based practices. There's information about evidence-based practices. We stressed that a lot last year. This year we're focusing a little more on housing, but I encourage you to read the document, maybe even go back to last year, because we learned more about evidence-based practices from one of our board members, Frank Bohm, who's a physician at Vanderbilt. And medicine has done a really good job of using what works. In social and human services, we have done less well at that. So it's important to try to find the things that do work. Okay. The primary data that we have, and I'll refer to, is from our grassroots community survey, when we've surveyed about 7,000 consumers in Davidson County since we began doing the survey a few years ago, as well as as well as United Way's 211 data. They have been very generous in sharing their data with us, and there are some common things about what we have found. This year, for the first time, we have information about something that was formed a little over a year ago, the Financial Assistance Coalition that was made up by the agencies that provide financial assistance to people who cannot meet their basic needs. The secondary data comes from the Census Bureau, Bureau of Labor Statistics, a lot of government organizations, so that is plentiful through the needs evaluation as well. Okay, let's talk about some of those statistics that are in there. In 2013, which is the most recent census data available, the population of Davidson County was 658,602 people. And there's some things that are a little different about Davidson County. For example, we have a younger median age than either Tennessee or the United States. It's a couple of years younger, 34.2%. We also have, and I'm not supposing why Oscar can do that, Dr. Miller, we have a smaller percentage of people under age 18, excuse me, and a smaller percentage of people over 65. That means we have a larger population of workforce age people, 18 to 64. We have in terms of income, we have income disparities across Davidson County, and we will show you some maps that demonstrate that. There are maps in the needs evaluation, other maps online, and by next week we will have the document that you received online, a slightly expanded version of that document, and this PowerPoint presentation. So next week we'll have all that on our website for you to access if you need. But we have in Davidson County 30,367 households with less than $25,000 income. That's one side of Nashville. The other side of Nashville has 46,363 households that have more than $150,000. So how many people do you think are in poverty out of 658,602? How many people are in poverty? We'll get back to that in just a minute. This kind of graphically shows the two types of Nashville. Probably everybody would like to be in the side on the left, but too many people are in the side on the right. Okay, this shows the per capita income, and per capita income is sort of an average of everyone that lives in the particular area, so this is an average of people who live in Davidson County individually, 28,440. But if you look at the orange and the red, these are all in areas that have higher poverty rate, lower per capita income that is lower than the Davidson County per capita income. It's 28,000. The ones in green, and you see that's not a big area, the green section. And it's 8 council districts that are over that median income or per capita. This shows the median, mean, and per capita. Median is the point at which they're 50% over, 50% under. Mean is the mathematical average, and per capita is for each individual. And in most cases, Nashville, Davidson County, does better than the state of Tennessee and worse than the United States. However, Davidson County's per capita is just a little bit higher, it's quite a bit higher than Tennessee and a little bit higher than the United States. Okay, what is poverty? This is a poverty guideline established by the federal government based on the formula that was created in 1964. It considers only cash income and the number in the household. There are lots of other things it needs to consider, and they are working on developing another measure. They actually have a supplemental poverty research measure that can be used, but the official guidelines on which benefits are based is this. Okay, now we're to how many people are in poverty. 117,231. Well, to put that in perspective, that's enough people to fill the Bridgestone Arena, the Titans football stadium, the New Sounds baseball stadium, Ryman Auditorium, and the Grand Ole Opry combined. That leaves about 11,000 other people left over, enough to populate the entire city of Crossville, Tennessee. So we have a lot of poverty here. It has gone down a little bit since last year. It was 122,000 in poverty, but that's not much comfort to the 117,000 that still live in poverty. Okay, I want you to pay attention to this map and the next map. The part that we're focusing on is the red. The red shows areas in Davidson County that have a poverty rate higher than 20%. This is the year 2000. We come forward on the next slide to the most recent census data, which is a summary of 2009 through 2013 that was released this past December. So watch poverty as it changes from one period to the next. Goes north, south, east, and west. And this is not the right direction. This has only been since 2000. Let me go back. That's a concern to me, not only as an employee of Metro Social Services, but a resident of Davidson County. Okay, poverty is not distributed across the county equally either. The poverty rate in Davidson County for all people is 17.8%. 17 Metro Council districts in red have poverty rates, have 20% or more of the people who live there in poverty rates. There are 6 Metro Council districts that have less than 10% of the residents in poverty. And it goes up and down kind of along the same way that the income did. Where there's lower income, generally there's higher poverty. The grassroots survey, and I'm not going to go over all these except to remind you that it is in the documents you received, but 2 things continue to come to the forefront of what people say they need. This is from the Grassroots Community Survey, in particular, that I'm talking about, but United Way has some similar information that I'll mention in a little bit. The 2 areas that continue to be identified as most in need are housing and neighborhoods. Specifically, people are unable to pay their rent and utilities. Secondly, is workforce and economic opportunity, and that is the lack of job training and the mismatch in terms of, which is part of the mismatch in terms of the jobs available and the skills that people have. So those are important issues, and I hope you'll read more about those. Okay, we know who's going to be poor in Davidson County based on the census year after year. The green areas at the top, the lowest category in poverty, is married couples at 6.1. All people at 17.8, and as you go down the list, it gets more and more tendencies to be poor. The highest number in poverty, the highest rate, is for a single mother and a child at 39.6%. As I said, United Way, their calls show that the greatest need is housing and utilities and income assistance. Okay, if you want to do something, there are lots of organizations to volunteer with, like Hands On Nashville. If you're interested in trying to change the policies that make determinations about what programs exist and how programs are done, there are a couple of agencies working on this right now. Avi Poster in the front row is one of the main leaders of A Voice for the Reduction of Poverty. A Voice for the Reduction of Poverty. It's on the web. It has a website. It has Facebook. And NOAA, Nashville Organized for Action and Hope. And I know there are people from NOAA here as well. And so with that, I'm going to turn it over to Julius Witherspoon, who will speak about aging and disability. Thank you.
I did this presentation before an audience of Vanderbilt students about 2 or 3 weeks ago, and I was surprised at the number of hands that were raised. Let me ask you, when we talk about aging and disability, we use the term that either you're going to be a caregiver over the next 10 to 20 years or you're going to need one. Let me show of hands of people who are caregiving for either elderly or disabled people now. No surprise to me. And many of you all are in the sandwich generation, meaning you're caring for an elderly and for a young child. And so as we go through this, I want to talk a little bit about what Nashville looks like. In the past, we used long-term services and support. We've changed that now to what we'll call an aging and disability. Long-term services and support was a federal definition of services that were provided to people who were elderly and disabled, and money was tied to it. When you talk about TennCare, you'll hear those terms of long-term services and support. But aging and disability gives us a larger audience and a larger subject matter. When we talk about aging, while Nashville, as Dinah has said, our average age is about 34.2, our senior population is the fastest growing population in Davidson County, and we do not hear a lot about that. In your book, you'll find several things related to aging and disability. Walking difficulties, ambulatory difficulties are the most likely to affect the population age 65 and over. How many of you know of someone who's had hip surgery or knee replacement recently? Wow. And persons with disability have incomes lower than those persons without disability. Dinah talked quickly about the supplemental poverty measure. The supplemental poverty measure somewhat does an injustice to seniors and persons with disability in that it does not factor in medical costs. And if you have been anywhere other than under a rock, you know the cost of medical as we go forward. Where do the elderly population live in Davidson County? If you look at the dark blue, is where over 20% live. And if you think about it, where are the hospitals and the medical services? In the inner city for the most part. So you not only have seniors move away from where the medical facilities are, you also have the issue of how do we get to the medical facilities. Transportation is a huge issue, one that we are not addressing here in this community needs evaluation, but is one certainly on the radar. And for those persons who are running for elected offices, you know that transportation is an issue that you will have to address in the next few years. The percent of population and types of disability on the second row, you'll see persons age 65 with a disability. In Davidson County, 37.2% of those. That's 1 out of 3 of our populations with over 65 with a disability. If you go further to the right, you look again, the ambulatory difficulty. People with difficulty in walking is one of our fastest growing disability issues. And so when we think of things that are happening on the area where people who are having difficulty walking, if you think about going to the grocery store, if a person 65 years old is trying to shop, where do they pause to sit? There are no areas to do that. And so difficulty with walking affects a lot of things here. When we talk about aging difficulty, we talked about poverty status, and again, going back to the official poverty measure and the supplemental poverty measure, if you look across the board from 2009 to 2013, the persons age 65 over, our aging and disability, their poverty status moves. When we talk about it from the official poverty measure, you'll see it's from 8.9 to 9.5. But when you look at it using the supplemental poverty measure, where medical costs, prescriptions, and medical aids are involved, you can see that that number jumps to 14.6% across. And so our aging and disability population will need some attention sooner than we think. When we talk about persons with disability, look at the income disparities, particularly for Davidson County. While we're a little higher than Tennessee, we are right around the national average, but if you look at the difference in persons with a disability, their earning status versus those without. When we talked about TennCare Choices was part of the long-term services and support. For a number of years, your only option almost using Medicaid and TennCare dollars was to go to a nursing home to receive care. It was the least likeliest place where people wanted to go. People wanted to stay at home. Tennessee, in their infinite wisdom in the last since 2005, that has shrunk to the betterment of persons with a disability, meaning that we're moving away from institutional care to home-based care, which is much more preferred. But if you can see the disparity that was happening in Tennessee, local county governments have little influence over that. But when we look at Davidson County, we are also with the fastest growing population. If you'll notice that there are more institutional facilities coming in Davidson County. A couple of things happening as we talk about aging and disability. While I talked about quickly hip and knee replacement, there's a program called A Matter of Balance. The Greater Nashville Regional Council brought that to us here on a smaller scale, but A Matter of Balance is a program that has been developed to prevent falls. Falls is one of the primary reasons why people having hip, knee, and joint replacement, and so A Matter of Balance helps seniors and persons with disability for one, prevent falls, and two, how to manage falls if they do happen. The other thing is what we found is elder abuse shelters. Elder abuse, both physical neglect and financial, is one of the fastest growing crimes against aging persons. And what we have found, financial exploitation. Here in Davidson County and across the state, if a police officer responds to a physical abuse and neglect shelter versus a domestic violence where the victim can be removed, here in Davidson County and across the state, there's nowhere to take an aging and disability person in terms of removing them from a crime. When we talk about Erie County, Buffalo, New York, they now have not only for domestic violence places, they also have beds in domestic violence shelters for persons with elder and abuse, and we look forward to addressing that issue in the near future. I want to quickly shift to food and nutrition, one of the basic needs in Davidson County here. Our key finding is still across the nation, 16 million children are in food insecure households. For seniors, Tennessee still ranks in the bottom of seniors facing the threat of hunger, and emergency food distribution and second harvest has gone up each year. When we talk about food insecure households, if you look across the spectrum, you'll see what Davidson County is a little higher than the state and the other. Food insecure means simply that people have expressed that they do not have enough money to provide food for their children and families across the month. We had that happen very recently here in Davidson County with the inclement weather. We found that many of the children who were using school for their breakfast and lunch did not have that access. And now, so we had to use schools, and Second Harvest had to expand that. And so we have to look at ways to be sure that we're providing food to children and families, not only in a normal operation, but in an emergency situation. Again, Tennessee ranks 5th when you look at the threat of senior hunger. If you look at here in 2012, again, almost one out of 5 seniors are facing the threat of hunger. Emergency food distribution, if you look across from Second Harvest's numbers, you'll see that number has risen, and this year in 2015, due to inclement weather, we think that number will rise significantly, and we have some Second Harvest people in the audience who are dealing with that as we speak. The median income for people who are receiving SNAP, which is food stamp benefits, look at the income disparities we talked about here in Davidson County and across this is just Davidson County. If you look at it across the state and the nation, it's higher. And lastly, a couple of things in terms of some things that we found work to address food, particularly for seniors. We call it the Double Up Bucks Farmers Program, where seniors are able to get 2 for 1 when they take their SNAP benefits or cash to our local farmers market. We ran a pilot program over the last 6 months, and it was extremely successful, and we're looking to expand that. And so when we think of seniors, access to fresh fruits and vegetables is important. And I don't have to say about improving access to after-school meals. Many of the students that go home use Metro schools not only for an education, but it is, in many cases, their primary source of food. So as we look at seniors and our most vulnerable, we want to be sure that we are addressing not only their food access, but healthy food access. I want to turn this over now to my colleague, Joyce Hillman, who will talk about health and human development, and thank you for your attention.
Good morning. It's a pleasure being here this morning. So good to see so many people that have been with us in past C&E presentations. And today, since our time is short, we're going to focus primarily on the trends and the data that are the current things that are changing in health and human development. We know that the foundation of health begins in early childhood. We know, according to research, that 90% of the child's brain develops in early childhood. Research also shows that when the child goes without nurturing and proper care and caring adults, that their health is often compromised, as well as children that are in poverty. One of the factors that we focus on in our presentation of health and human development are the socioeconomic factors as well as the social determinants. That way, we want to make sure that we're presenting those issues that are having those indirect as well as direct impacts on our families. We also know, according to research, that children in poverty experience higher incidence of childhood injuries, chronic diseases, as well as learning and behavioral problems. As we look at health, we want to always take into consideration that health is more than just exercise and treatment. It's where we live, it's how we live, and what we think about our lives as well as our genetics. Tennessee's overall health was ranked as 42nd in the nation, 42nd being one of the worst in the nation in 2013, and that's what we had at the time of the publication of our CNE. One of the things now is that the most recent data from America's Health Rankings is showing that we're now 45th in the nation. One of the most prevalent problems, or some of them that's pressing and causing a lot of issues with the state, deals with the problem of obesity as well as inactivity and violent crimes. In Tennessee, Tennessee has shown improvement as far as the kids count. The Annie Casey Foundation says that we're improving in health and well-being of children, and that's encouraging. According to the 2014 county health rankings, they showed that Davidson County was 13th in the nation as far as outcomes, which include our quality of life and how long we live, our morbidity and mortality rate. But in terms of the physical environment and the built environment, we were not doing as well, but we did show improvements, and I'll talk about that. But these are the factors that we consider when we look at health, physical environment, and the health factors that are being affected. We know that the physical health is very important, the environment, because it impacts illnesses. It impacts the development of illness and progression of illness and diseases. In 2014, Davidson County's greatest challenges, according to the health rankings, was related to driving and driving alone with too few people in the car, long commutes, as well as our drinking water. As you can see from the chart, that there was some issues with the drinking water. Now, I know you might wonder what that means, and of course, that's simply that there was some violations. There was some regulatory standards that were being violated, but it has improved, and that's improved according to the new rankings that's out, and we're now at 77th as far as physical environment and built environment, whereas last year we were at 95th out of 95 counties. Other health factors that impact our health are poverty, nutrition, and those socioeconomic and social determinants that have a tendency to compromise our health. In Tennessee, there are still, according to the health insurance rate, and since the health exchange marketplace, there's still over 180,000 people who are eligible for Medicaid, who cannot afford health insurance and still fall into that gap. There are now approximately 45,000 in Davidson County, and approximately 216,000 people in the United States that are homeless and are adults they have untreated mental health diagnosis. We also have approximately 1/3 of the people that are incarcerated that experience mental illnesses and untreated care. As far as our behavioral risk, we still struggle with the issues of excessive drinking, obesity, and smoking, and this was somewhat similar to last year. And we are improving in Davidson County, and the new rankings show that we are improving in the area of adult drinking and smoking. Of course, in Tennessee and the nation, as well as Davidson County, we still struggle with obesity. As you can see, in terms of the sexually transmitted infections, we still are ranking up in the higher ranks. In comparison to the nation and the state, we have higher numbers reported per 100,000 people. So that has been discussed, that maybe we in fact do a better job of reporting. So we can look at it from that perspective. And of course, one thing that's very clear now is that we know that prescription drug abuse is very prevalent. In Tennessee, we have a very high number. As a matter of fact, Tennessee ranks second in the nation for the number of opiate-prescribed pain relievers. And these are actually legally prescribed. These are the number of prescribed medications, and you can see the trend continues to go up. That was the latest information, but we do know that the numbers are continuing, and the governor does have a lot of programs that they're trying to put in place, and this is something that's actively being addressed. One thing that's clear we didn't have a chance to put in here is that we have a chart that shows how most people get access to these prescribed medications, and it's over 62,000 people in the United States that die annually from overuse or abuse of opiate prescription drugs. And we found out from the data that most people, almost half of them, get their prescribed medications from, not from legal prescriptions, but from friends and families and other sources. So in closing, I didn't have a chance to put the other charts that we would have liked to have because of time factor, but we just want to keep in mind that we do have also a lot of the evidence-based practices that are also listed in our community needs evaluation, and we encourage you to delve into those and find out more about what others are doing across the nation as well as the state and in Davidson County in terms of best practices. Thank you.
Hello, my name is Lee, and I'm going to talk to you about affordable housing. We have a crisis in Nashville, but we're no different than the rest of the country. The red and the orange parts of this map, similar to the other maps you've seen, these are the council districts where 50 to 68% of the renter households are cost burdened. That means they pay more than 30% of their household income for household expenses. In 2013, 41% of Nashville's children lived in cost burdened households. This shows the amount from the Paycheck to Paycheck database, which I encourage you to look at, shows the amount needed for housing and the median wages for some jobs, which are very important to Nashville. As we grow, as we get more tourists, and we're building hotels, we're going to need housekeepers, we're going to need child care workers, bank tellers, retail sales staff. As we boomers get older, we're going to need more nursing aides. All of these folks, as of 2013, needed to work more than one minimum wage job to afford housing without being cost burdened. The Urban Institute says that in Davidson County, for every 100 extremely low-income families, there are 30 affordable available households. Houses, places to rent. That's a significant shortage. At Metro Social Services, when our clients come in, we have a little front desk survey that has some boxes, and it's anonymous, and they check off, what do you need? And we have housing and jobs and transportation and nutrition and counseling. From July 2013 until very recently, 85 to 90% of the clients check off the box that says housing and related expenses. 85 to 90%. Half of those people, that's the only box they check. That's all they need. Mortgage arrears, move-in expenses, rent and utilities, reconnection fees, just a lot of different needs. Since 2007, there's a population that doesn't have anywhere to live right now, our homeless population. And as you can see, it's 2,000. We've done a little better job on single folks. And a lot of that has to do with the House in Nashville, HOW''S Nashville initiative. You can Google that too. Part of that has to do with the tremendous emphasis that the Veterans Administration has put on housing veterans, with VASH vouchers, with families with children. We have more work to do there. We're not making as much progress. We're no different than other cities across the nation or counties. Everybody's got a problem. Everybody's solving it, attempting to solve it in ways that fit their community. Streamlined permitting, land banks, using surplus public land for affordable housing. We're very fortunate here that we have the Barnes Affordable Housing Trust Fund. Thank you, Reverend Barnes, for working on that for 20 years, and Eddie and Kay and the other folks that have been involved. It's not a perfect step. It's not. We still are looking for a sustainable source of funding for the Housing Trust Fund so that it can go on year after year. We have 3 projects in the works right now from the first round of funding, and if you call the office or talk to me, I'll tell you where you can go by and look at them. Interestingly, the housing industry is looking at some things they never looked at before. Manufactured housing, modular housing, tiny houses. If you watch TV, you see the tiny house nation. Those aren't the people that we are concerned with right now. They tend to have a little more money. Mobile homes. So there are a lot of creative things that cities are doing. We still have things to do, but we have a lot of committed people working on it. Thank you.
Good morning. I think we see the picture in the middle. That's a very familiar picture. When we look at workforce issues and the labor market in Davidson County, the good news is that unemployment is down. Actually, about a year ago in April, we registered the lowest unemployment rate for a long time, 4.7%. And actually, it got better. According to Tennessee Department of Labor and Workforce, when they measured the unemployment rate in Davidson County last month, it got to 4.4%. That means the economy is doing so well here, and the labor market is good. But most labor economists, they just don't look at that number. If you ask the people on the street here, and you say, well, unemployment is 4.4%, what's the problem? They will tell you problem is like this one. Let us look at the numbers beyond 4.4%. 1/3 of the unemployed people are what we call long-term unemployed. Means they have been out of work for more than 26 weeks. I mean, 6 months and more. What happens to those people? They still struggle securing employment, and when they obtain a job, they earn less because there is a large pool of unemployed people that they have to compete with. And also they bear long-term financial consequences because the longer you stay unemployed, you eat up your savings, so that's no surprise. We said that unemployment is 4.4%. So many jobs created in this area, but most of them is what we call the proliferation of low-wage jobs. When we look at the recovery that happened since the recession, and you all know that that was about 6 years ago when the recession ended in June of 2009. Lower wage jobs were about only 22% of the jobs lost during the recession. But they are what? 44% of the jobs created since the recession ended are in the lower wage jobs. Mid-wage jobs, they were 37% of the jobs lost, but 26% of the recovery. High-wage job, 41% lost, 30% created. Let us look at the numbers and the jobs created in the service industry. And as we know that the economy now is more of in the service sector than manufacturing. Those are the wages, and look at what happened in the last 4 years, those wages. Especially if you look at number 7, cooks and restaurants, because we would love to go out and eat. But the people that are cooking those, what happened to their wages? Actually, it decreased 8%. Similarly, if you look at home health aid, and all these categories, as you can see, that's where the wages are. And to let you know that in 2013, the latest numbers that we have, listen to this, 50% of Davidson County workers, people who go to work in the morning and get a paycheck, half of them made only $29,000. That's the median wage that is available in Davidson County. On the other side, 81% of businesses, what they say is that we don't have enough skilled workers here who can fill the jobs that are available. I mean, that's a nationwide poll. But that's the reality in terms of skills jobs. There are jobs out there, forget about the ones that pay low, but there are well and high-paying jobs out there. But employers will tell you they don't have people who have got the skill sets. When we look at unemployment and different ethnic groups, African Americans in Davidson County in 2013, unemployment is 10%. The other groups are better. When we look at people with disability, almost 18% unemployment in Davidson County. Compare it to the people with no disability, which is 6.7%. If you don't have a college degree, the chances that you would obtain and attain and sustain employment gets worse. People with less than high school diploma, unemployment rate is 15% compared to people with bachelor's degree. So, when we summarize what's happening at the workforce in Davidson County, we can say that unemployment numbers are good, 4.4%. It doesn't get any better than that. But when we look at the numbers beyond that, we notice that African Americans, people with disability, people with less than high school education, and people that are in the long-term unemployment, they still struggle to obtain employment. Questions and answers.
We ask that if you have a question about what we've just discussed, if you would please come down to the microphone. We have a few minutes for questions and answers, if you have any. Okay, what we're going to do next after this is take a break and for about 10 minutes, and then we ask, go get some more refreshments if you like. We ask that people not bring in coffee or food into the auditorium, which I should have said earlier. Yes, ma'am.
Yes. Hi, my name is Jennifer Trail with the Family Center. My question is for Ms. Hillman. We know from research that adverse childhood experiences and child maltreatment can lead to certain risky behavioral, physical, and mental health outcomes, including some of the ones that you mentioned in your presentation. And I'm wondering if Metro Social Services looks at the data from the Department of Children's Services of substantiated child abuse and neglect cases and how it relates to poverty in Davidson County and some of the outcomes that you mentioned.
Okay, we look at, what we look at, of course, is all the available data. And of course, we do look at DHS and DCS outcomes and numbers. Sometimes it's not as readily available. We do try to focus on Davidson County. We don't have as much particularly for Davidson County as we'd like to have that's most current. So actually, if you could help us in terms of leading us to where we can get the most current data. Most of the time it's secondary, and it's that's available already to the public. I do have someone in the state that we do sometimes get some of the data, but most of it, again, is what is already public to, for us to access. So if you know where we can get more current data, we would certainly appreciate it and make sure that we publish it.
I'd love to explore that with you, sir.
Thank you.
Yes, sir.
Hello.
Hi.
Good morning.
Good morning.
I'm Mike Turner. I live in Old Hickory. Metro employees, the lowest paid Metro employees are barely above the poverty level as is. All right, now you put their benefits, their pension, and their insurance in there. That lifts them up and keeps them above poverty level. Over the last 15 to 20 years, though, metropolitan government has done away with thousands of jobs. Okay, and replaced them. And a lot of it's been through technology, but most of it has been through privatization of government services. So we've taken somebody making $30,000 a year, drop them down to $20,000 a year. The person with $30,000 a year was making insurance and benefits. And now they're making $20,000 a year with no insurance and benefits. Now, Metro itself has contributed to this problem. And I was just wondering if y'all studied that part and how much Metro has caused the poverty itself to expand.
Well, the labor market is a very complex market. As we saw, the numbers we show, which says unemployment rate, which is the one that they use to measure, is down, but the reality is different. However, Metro as an entity is no different than any other businesses if you look at in the area we live in. Part of that is there are three things that happen in the United States that impacts wages and those kind of things. We know that technology has displaced a lot of workers. Therefore, the introduction of the new technology that we saw has impacted workforce. Globalization has become a factor also. When I arrived in Nashville about 25 years ago, it was a good manufacturing base that existed here and people were making good jobs. But since then, if you look at what replaced it was, what we showed here, which was service industry, that doesn't pay a lot. The other factor is that the weakening of the unions have become an issue, and that's a nationwide. It's not about just Metro. But unions don't have a voice anymore to influence the wage. So, and the country has moved to the right. I mean, I'm sure there are people that want to be elected in this room. No one would go out there and say we need to establish a living wage, because that's contrary to what the Chamber of Commerce and others believe that. So, and we live in we are a blue county surrounded by red counties. And as soon as you talk about wage, Wilson County, Rutherford County, they will all say, please move your business here. We don't have to establish a living wage. So that's why it's a complicated. I know that a lot of people may not agree with me, but that is a challenge that we face as a city, whether it's in the private sector or whether it's in the public sector. And, nationwide, that was also a factor in terms of money jobs that are being outsourced to the private sector. And they don't pay the same wage. And that's part of what they call, restructuring of government. So I agree with you that it's a challenge, but unless the community has an honest conversation about it, I think it will be something that we'll be experiencing down the road.
Yeah. Can I do one follow-up?
Sure.
Yeah, and thank you. That's pretty good answer, I guess, but it's not quite what I wanted to hear. And the fact that I wish you guys would study the question I asked, because we cut these jobs for short-term savings, or maybe even long-term savings. But when we force these people who are above the poverty line into poverty, then Metro's cost servicing them now that they're in poverty increases too. And I've never seen anything that has gone and said, all right, if we lay these people off and get rid of them and bring private sector people in, How much is it going to cost us to service them on the back end once we force them into poverty? I wish this commission would look at that. I think it would help the future politicians in Nashville. Thank you.
Thank you. Our role is a little more global. We are requested in the Metro Charter to do certain things, and one of them is to look at the causes of poverty and the resolutions of poverty and so forth, but, you know, we'll need direction from further than my pay grade to investigate Metro government.
My name is Barbara Clinton, and I'm a volunteer with A Voice for the Reduction of Poverty. And we've been working on the issue of affordable housing for the last number of months, and we're just getting ready to do more work and support other people's work on the issue of employment and a living wage. And I recognize the difficulty of it, and I appreciate the last question and your answer, Abdel Ghani, and I completely agree. But I wonder if you can share with us any best practices from other places around the country where they've successfully addressed the need for good quality jobs.
I can give you one quick one that I found fairly recently. Salt Lake City evidently has been praised across the nation for for their 10-year plan to end homelessness, which is, and they basically said that they needed to do two things: house them and get them jobs. So that's my contribution. I haven't read all about Salt Lake City yet, but they have a lot of words written, and they may have some magic answer in there for increasing jobs, or maybe AB does.
Well, I like to give practical answers. I know what I care is to see where people can make a living wage and have a decent life. The examples I'm going to give you is Baltimore, San Francisco, Seattle, Portland, Chicago, many cities that have implemented living wage. As far as I know, there is no southern state or city that has been able to implement that. I may be wrong, but as far as I know. So, and keep in mind that if we ever introduce something here at the county level, the state legislature probably won't be happy to do that. So they may override that. That's the practical answer that I need to give. However, there are communities and cities around the nation that have implemented all kinds of good things, including living wage. But here, I mean, you may be able to succeed at the council level, but I don't think you will get away with the state legislature in terms of that. They may call it job killing initiative or whatever.
We're coming up on time for a break. Maybe just one. How many more do we have? Oh, two. Real quick, please.
I'm Beverly with CCSI. Quick question. So we hear a lot about the low-wage jobs. Where are the high-wage jobs? What areas are they in Davidson County?
I think in the healthcare,
the companies that provide those.
In the healthcare industries are the ones that have got higher wage. And there's also a high-tech manufacturing, but most of them are located in what we call the donut, where most unemployed people, they don't even have transportation to get to those places besides their skills. So we are stuck in downtown and service jobs, but there are jobs in the healthcare, in the higher education, and there is a high-tech manufacturing, but they are outside of the county to neighboring counties, so that people that we care, that are very low income, weren't able to get there. There's no transportation to get there.
Thank you. Yes, sir.
Ed Branding, I do real estate research for people. Traditionally, the affordable housing issue has been met with federal money or Section 8 or things of that sort. A lot of that money is drying up. The Section 8 waiting list is, what, 2 or 3 years. Are you, number one, are you in favor of any incentives, or do you think politically it's going to be a problem to give incentives to developers? And are there any other cities where you have seen other affordable housing initiatives that have worked?
You must have missed it when I told folks coming in not to ask me any hard questions, Ed.
I was getting coffee.
Yeah, sorry about that. Yes, there are some cities that have successfully addressed this. There are 600 or more, Reverend Barnes can correct me on this, cities that have done things like inclusionary zoning, mandatory inclusionary zoning laws. They've streamlined permitting. They've arranged for surplus land to be legally transferred to nonprofits, because one of the problems with nonprofit developers is the cost of the land. And if anybody's now tried to buy anything in Sylvan Park or places like that, you know that land prices are tremendous. If you will look in your books and find my email address and email me, I will send you some of the stuff I've accumulated. Right now, I can't think of any particular cities. Let's see, nope, can't think of any particular cities right offhand, but just shoot me an email, Ed, and I'll, and look on the web when we put our entire community needs evaluation on there. It'll have more information and have some best practices.
Thank you.
Thank you. And we have representatives from the two advocacy organizations. We have Ashford Hughes from NOAA and others here from NOAA, Avi Poster and others here from A Voice. They're working on some issues related to affordable housing, both of them. And other cities have done a better job than Nashville in some cases. So it's important to look at the evidence and see who's done what and how we can do something that's more effective. So we're going to... Yes, sir. This is Howard Gentry. He was on our Board of Commissioners for many years, and he was one of the people who inspired the creation of the Community Needs Evaluation.
Thank you. Back to what Mike said, it's real. I'm a Metro employer, and many of my people, we're not able to pay way above the salary that I'd love to pay. But this is also a way we get off the point. And the point is that if you look at Metro's disparity study, the people who are affected, the people who are out of employment are minorities. Many of the people who are in poverty are minorities. And so Metro is not playing a huge role in those persons being in the condition they are. So as we do think about Metro government, and everybody applauds that, understand that the people that we're really talking about are not the people that were hired by Metro. They can't get hired. And so it's a bigger problem. So I just wanted to clarify that. Thank you.
Thank you.
Thank you. Thank you for all your questions. We're going to take a 10-minute break now, and let's be back here by 11:20.
Okay, good morning. I think we're ready to get started on the panel. My name is Adrienne Harris, and I'm Programs Director with the Housing Fund, and I'll be moderating today. We have a great panel, and I'll introduce everybody, and then I have a question for each one of them that they'll have about 10 minutes to discuss, and then we'll have some time for questions and answers afterwards. So directly to my left is Larry Wade. He's actually a resident of the James Robertson Apartments, so we'll get a consumer's perspective today. Beside him is Jan Seymour, who's the Executive Director of NeedLink Nashville. Directly beside her is Reverend Bill Barnes, who you probably heard a lot about Reverend Bill Barnes, but the Barnes Housing Trust Fund is actually named after him. We have Eddie Latimer, CEO of Affordable Housing Resources. And finally, we have Brent Elrod, who is Director of Projects from Urban Housing Solutions. So we're happy to have all of them today. What I'd like to do is start with Brent. I'll start at the end and come back. So, Brent, if you would, can you give us a brief kind of history of your current services, including your Barnes Fund project, and your pilot testing with the coordinated reentry into homeless housing network.
Sure. Good afternoon, or good morning, I guess it's still morning. I'm Brent Elrod, the Director of Projects for Urban Housing Solutions. Urban Housing Solutions is Nashville's largest nonprofit provider of affordable housing. We've been around since 1991, started with Mercury Courts, which is Nashville's, I guess, only really SRO homeless housing over on Murfreesboro Road. We have 100 units for SRO housing for the homeless. We now have about 1,000 apartments across Nashville, serving mostly folks at or below 50% of the median income, so that's about $23,000 a year for a single person. We do have an emphasis on special needs housing. That really tends to be an area where there's the greatest need, we feel like, in the housing market. Folks with physical disabilities or other challenges, disabilities that may limit their access to decent, safe, and affordable housing. We are fortunate to have been the, I guess, the largest recipient of the 2014 inaugural Barnes Housing Trust Fund grant that was awarded last year to us and to Be a Helping Hand, Woodbine Community Organization, and New Level CDC, I believe. Maybe just those three. That was a $1.5 million grant to buy and redevelop a very distressed property in North Nashville at the corner of 26th Avenue and Clarksville Pike. We're going to redevelop that over successive phases into very affordable apartments that will replace what had been a very problematic eyesore for the neighborhood. We're looking forward to that project. We're breaking ground in this summer and should be finished with the first phase next summer, end of next summer. I think I was asked to speak a little bit about our pilot with Metro Social Services on the coordinated entry system, which is a newer approach to centralizing all homeless housing placement in Nashville. As I mentioned, Urban Housing Solutions began in 1991 with our 100 units at Mercury Courts, which is the SRO homeless housing project I talked about. We are now working with Metro Social Services, as are all other homeless housing providers, where Metro Social Services is the central intake, for lack of a better word, to help place folks who are on the street, to help place those folks into a permanent supportive housing option. And it's worked very well. Actually, you know, we for 23 years, we had managed all of that application, leasing, and screening process internally. Now that's all handled centrally with Metro Social Services, who, I guess, places folks in apartments both in nonprofit housing, like at Urban Housing Solutions, at Mercury Courts, or also in even the for-profit private market. There are at least some apartments that some private landlords have actually contributed to this or made available to this program. And it's worked well. We have, I think we have seen this. It took a little time to integrate the coordination process between Metro Social Services and our own leasing process, but I think we've ironed out all those kinks since that was a new program. And I do think it's working really well. I think it makes the most sense, really, in terms of trying to match people who need housing with the best available housing option in the market, wherever that is. So that's been our experience.
I have one more follow-up question.
Happy to answer.
What does Urban Housing Solutions have planned for the affordable housing needs? You're usually pretty innovative, so kind of curious about what are some of your innovative approaches coming up in affordable housing?
Well, in the earlier presentation on the affordable housing crisis, where Lee Stewart was talking about some of the solutions that other cities and other agencies have tried to implement in other cities, we certainly are looking into some of those same concepts: manufactured, modular housing. The biggest challenge beside land cost that we experience is the almost unchangeable hard cost problem. Basically, the construction cost of a new apartment is what it is, whether it's for an affordable housing purpose or for a market rate apartment. And so the amount of public money that's available to subsidize affordable housing is not really increasing, not substantially. we're working on that locally, and hopefully with Reverend Barnes' inspiration, we can all try to live and do a better job to live up to that and put some more public money behind this goal. But you know, the problem is that there's not a lot of public money to subsidize construction or development of affordable housing, and the costs are the same as a private, you know, for-profit enterprise. And so the only thing we could do is we could try to either get some help from public agencies who can contribute land, which was mentioned in that as one option, or to bring down construction costs by pursuing more economical construction methods. Manufactured modular housing, those are actually, that technology and that construction approach has really evolved a lot in the last 20 years. And you know, there's some really cool projects in urban places where manufactured housing doesn't look like anything else you probably would imagine. It looks just like an apartment building that would be built from on site, but ideally for quite a bit less. So that's something that we're looking into pretty seriously. And you know, certainly any other type of I would call it maybe unconventional arrangement where there might be more shared facilities, similar to the SRO development at Mercury Courts that I mentioned, where 100 apartments just have a bedroom and a bathroom, but actually share kitchen facilities. That's actually something that there actually is, for some people, that actually is a workable and suitable arrangement where they don't really need their own private kitchen. And by reducing that amount of square footage and the cost to develop a fully equipped apartment, you know, you can bring those costs down and make, for some people, what would be a perfectly suitable and much more affordable housing option. So that's another idea we're looking into a little bit more seriously. I guess that answers your question.
It did. Thank you, Brent.
Sure.
So Eddie, we're going to move to you. Urban Housing Solutions does a lot of rental projects, so we're going to move to affordable housing resources. And if you could please describe, give us a brief history and some of your current projects that's happening in the affordable homeownership role, and also describe your participation in NeighborWorks America.
Okay, NeighborWorks America, just so you know, is a congressionally chartered nonprofit. It's a line item in the budget, and it's we've been a member of 15 years. We've been a member of NeighborWorks America. There are 5 other organizations in the state, and NeighborWorks groups. I'll get back to that in a minute. But Affordable Housing Resources has we're 20-something years old. I don't want to say because it would really date me, but we've been around, and we primarily have been about home ownership, although we have done a lion's share of rental. Our average buyer was a single mom with 2 kids. The average place of employment was government. Cafeteria worker, worked for the state, worked at TSU, worked somewhere downtown. And so this was pretty much our niche. We had 3 programs. We actually built and sold homes. We were up to about 65 or 70 of those a year. When the housing crash came, which had presented its problems once the crash hit, we also have seen about 16,000 people go through our education programs seeking to buy a home, and then we also do some lending. And we have got a new product out now that's sort of is a new mortgage product to help counter and make it more creative so you don't have to quite be FHA eligible and still get a government-backed mortgage. And so we're working on that one too. But what the issue is we're looking at getting back into construction. Historically, a recession sort of reloads the affordable housing stock. But that didn't happen this time, primarily because of the investors. And the investors came in, local and from international, and started buying up property all across the country. We were not a first-pick city by any stretch of the imagination, but as Nashville started to boom, more and more investors started buying the property, which drove property prices up. So we've got 2 issues. Is the property, when we sold our last home in 2008, we sold it for $130,000, 3 bedrooms, 2 baths, 1,300 square feet. You cannot buy a lot in most of those neighborhoods where we used to build homes, do infill housing, for that $130,000. So this is a huge problem. We're talking about a 50-foot by 150-foot lot. So this is a huge problem. Plus, construction costs have not gone down like they normally do in a recession. And the other thing is back when Jerry Nicely was at MDHA, we got several $1 million in home funds, HOME, it's a HUD program, but that's where most of the subsidies came from that created Nashville's affordable housing. Today, we're getting less than $1 million. So the feds have, Congress has really cut the Fed budget on this level. Prices have gone up for land. Prices have stayed the same on construction. So just to pick up what Brent was saying, we really have to figure out a way. We've got to redefine the product. What is an affordable home, rental or home ownership? And we've got to be able to do it without federal grants. So we've got to do it very cheaply. And the need continues to grow. And I'll just give you an example. I did a little research last year, and in 2013, there were right at 3,500 apartment units were brought online in the MSA, and 430 or so, I'll round off numbers, don't ever hit me for a detail on that level, but 430 or so were affordable, and they got affordable because they had some kind of federal identifiable subsidy in there, like a low-income housing tax credit or a HUD mortgage, Fannie zero bond, those kind of things. In October of last year, we had right at 10,000 apartment units under construction in our MSA, and not one was affordable. Now, I don't know, there may have been some small units being developed with home funds. The Barnes Fund hadn't quite kicked in yet. But the numbers, we have to find a way to start creating a larger volume. And I think to do this, we really have got to start working together. The banks, we can get creative, but Nashville really needs to look to Nashville to create more products, finance products, that would allow us to create the housing we need, because it's not going to come at the Fed level. And we do have some resources at the state, but they're maxed out as well.
You answered my follow-up. So I had a follow-up question about what you feel like is the greatest need, but I think you've kind of addressed that. So we'll move to Reverend Barnes. What we'd like to hear from you, Reverend Barnes, is if you can give us a brief history of the affordable housing need and the need for sustainable funding for the Housing Trust Fund.
You're asking a Methodist preacher to do a brief?
Brief, yes.
Folks have done that in vain before. But I appreciate being here. It's wonderful to see your faces and to know that you're here not only to pick up facts and statistics and so forth, but to care. It's one thing to know about housing disparities. It's another thing to care. And it's my own life. 4 years in the Sudicum-Napier projects, 30 years in the HO projects neighborhood during urban renewal. So about to ride into the sunset, and it's just enlightening to see you here this morning and caring about it. The guy down at the Y the other day told me, he said, man, he said, I've gotten so old. He said, almost everything I got hurts, and what doesn't hurt doesn't work. And I think I wrote that book, yeah. So, I unapologetically say to you that my abiding care about housing begins with theological concerns. Theological concerns tells me that all the children who are growing up in concentrated poverty areas are beloved children of God. Now, you may have a metaphysic of your own, hope you do. But example, in 2000, and I remember this, in 2000 the census indicated that the number of households not people, but households. The number of renter households earning less than 30% of median family income, paying more than 30% for their rent, numbered in Davidson County, and I'm looking at the number, 25,472, not people, households. Multiply 2.3 and you get people. 10 years later, brothers and sisters, 10 years later, 2010, the number 25,000 had moved to 36,000 plus. Cost-burdened renter, low-income households in the county that you and I live in. That number stirs my mind in my sleep and my nightmares and so forth. Because I know from life experience, 3.5 decades, living, working in public housing neighborhoods, I know what that costs children. I know what cost burden means. Cost burden means if you pay more than 30% of your income for your rent, you've got to cut you've got to cut into other necessities like food, transportation, etc. There are people in our city who are our neighbors who are cost burdened and who still live in concentrated poverty. Been so much written lately about concentrated poverty, what it means to children growing up to be in not a house but a neighborhood of concentrated poverty. To live in concentrated poverty means what? Loss of safety for your kids, means high unemployment, means poor schools. It means other negative factors. We care and we're going to change that. So the Barnes Housing Trust Fund is simply an outgrowth of that abiding concern for God's children until every boy and girl, man and woman is housed with dignity. I want to talk for just a minute about the Housing Trust Fund. In the decade, brothers and sisters, of the 80s, in the decade of the 80s, let me betray my political leanings. In the decade of the 80s, between the beginning of the 80s and the end of the 80s, listen, 75% of the federal line item in the budget disappeared. 75%. Started the decade with more than $90 billion, ended the decade with a quarter of that. Now, what do you do about that? What do you do with such a huge hole? And if I had another hour, I'd start talking about that from at least the end of World War II. We have incessantly, consistently dug a hole in the need for housing for low-income people, so that the Barnes Housing Trust Fund comes along. Adrian, we sat on that egg 23, 24 years to try to revive concern and resources for low-income people from 25,000 to 36,000. So that As the New York Times article a few months ago said, we're experiencing less racial segregation in housing and an increase in class segregation in housing. So I just come as an octogenarian to you this morning, with you this morning, to deliver people from concentrated poverty. What does it mean? We had just a quick story, Adrian, and believe it or not. Okay. Really excellent custodian, Fitz. His son, Brian, was on drugs. Remember Sam's Beer Barn on 12th Avenue? Brian was shot and killed in Sam's parking lot. And we had a memorial service for Brian in the parking lot where the incident occurred. I had been to Nicaragua a couple of 3 times and worshiped in a cathedral there. When the names of the persons killed by the Contras were called, and every time one was called, the people stood and screamed, "Presente." Present. They are not going to be forgotten. They're going to be remembered. They're going to be imitated. And at the end of the memorial service, I said, and I guess there were 30, 40 people there. If there are others of you who have sons, husbands, whatever, who've been shot, let's call their name. And you know what? At least 6 or 7 people there called a name. And we said, "Presente." Nobody deserves to live in communities without safety, without good schools, where we dismantle concentrated poverty. Again, I'm grateful to see your faces, to see you here. Thank you.
Thank you so much for sitting on that egg. We're very fortunate. So Jan, we'd like to know, I guess, the need from your clients that you work with in sustaining current housing, and what kinds of requests you get.
Sure. I'm Jan Seymour, and I am at NeedLink Nashville, which many of you who have been in the Nashville community for a long time may know as Big Brothers of Nashville. We've been around for about 100 years. And right now, our primary focus is on assistance with housing needs. So every week we'll see, I think last week we saw 130 people come through our door who needed help because either their lights were going to get shut off, they were going to have their water shut off, they were going to be evicted from public housing. So take that times the 50 weeks in a year, and we see about 6,000 applicants, people who need help, who without a little bit of assistance are going to either not be housed at all or are going to be in housing and in conditions that we wouldn't want to live in. You know, their children are not going to have lights to do their homework by. They're not going to be able to cook dinner for their families. Any food that is in their refrigerator is going to spoil. Any medicines that are in their refrigerator are going to spoil. They're not going to be able to take a bath. They're not going to be able to flush their toilets. These are the realities that people in our city are living with every day. And unfortunately, the resources that we have are limited, and we can only help about 1/3 of the people who come through our door every week. And that's really hard for us to just sort of go through and determine where the help is going to have the biggest impact for people. But I think that the underlying conditions of the need are maybe as important as the need. You know, the people that we see really don't have a lot of options. Either they are people who have experienced long-term unemployment or not a lot of good skills that they can take into the job force, so that they have a string of low-wage jobs where they're cashiers or they're cafeteria workers or they're working in service industry jobs. People who have severe disabilities that they're not able to work. Some of them do receive a little bit of Social Security income. Some of them do not yet and are fighting to get that. There's elderly people in our neighborhoods who are living on fixed incomes. And then there are families, and I think this is where it really plays into the affordable housing issue. There are families who are really trying to make it on their own. They don't want to necessarily live in subsidized housing, but we're not really giving them a lot of options anymore in Nashville. Our office is in West Nashville in the Nations neighborhood, and you can hear the rumble every day of houses being torn down. And these are houses that seniors live in that are selling for $50,000 is the fair market value. On a lot of these houses, they're tearing them down and they're putting 2 houses on those lots, selling them each for $200,000. So the people who are living in these neighborhoods are not able to stay in the neighborhoods that they just want to live in. These houses that are $700 a month, people can afford to live and they can scrape up $700 a month. And if it makes them cost burdened, it's hard, but they make it work. But when there are no $700 a month rents, then where do people go? So one answer is that they go to the fringes of the city. There's a lot of movement, I think, in our city to areas like Madison and areas like Antioch. But then that drives up the cost of rents there. I think that it was, I think it was the Sun-Times that indicated that occupancy rates for Nashville in 2014 were 98%. So it doesn't give people a lot of options. If they can't pay the rent one month, their landlord doesn't care. They can find somebody else tomorrow who can take that spot. And they will. And I think another challenge is that in these areas where there is still some affordable housing stock that landlords are holding on to that are those smaller houses, they don't have the incentive to invest in those properties in ways that people need. They don't have the incentive to invest in the HVAC systems. They don't have the incentive to fix the crack under the door, to really do anything, because they could sell these properties tomorrow. And they know that. And so the conditions of housing for people are also challenging, which makes more challenges for them in terms of utility bills. So people who are in rentals tend to have a lot higher utility bills because they don't have the option to fix it themselves. They can't weatherize their house. They can't do a lot of these energy efficiency things that you and I take for granted. So I think that affordable housing is a huge challenge, and trying to figure out where people are going to go because they are struggling, and we see their struggle. And so one thing that we have done that we're hoping is we're at least bringing our financial assistance providers together to talk about what the issues are and how we can all work together with the small amounts of resources that we have available to put those into action in effective ways. So if somebody is being evicted for $700, can part of us pay part of it and part of us pay another part of it? Because that's hard for any agency to come up with. But how can we do it to where it is an effective intervention, and how can we build those relationships so that we can have more effective interventions? And that's a great thing, I think, that is going on in Nashville, is that there is a lot of energy, and there are all of you in this room who care about these issues. And by coming together, I would not say that we have come up with any solutions, but we've laid out the problems that we know exist, and we're going to start working on what can we do. I think coordinated entry for homelessness is an amazing component of that, and it's just a really good example of what can happen when people do come together around these issues to try to help people.
Amen.
Jan, let me ask, if someone is interested in joining the Financial Assistance Coalition, would they contact you, or who would they need to contact?
You can contact me or Julia Gildemeister up there from Rooftop. We've kind of been just coordinating the meetings, but we try to keep it as a forum as much as anything, where we can have these discussions, where we can build relationships. We don't have laid out meeting agendas. We come together and we talk about the issues that our mutual clients are facing and how we might be able to address those better.
Okay, thank you. And we have Mr. Wade here that's going to give us a consumer's perspective on the affordable housing need. So if you can give us your personal testimony of trying to find affordable housing here now that James Robertson will no longer be, if you would just give us a few words about that.
First of all, the element of surprise. When it happened without any knowledge of the people that was at James Robertson. And then the stepping out, being receptive unto what was a surprise. I found that things were not as they used to be, as I had known them to be. Things had changed. 6-month waiting period. You have to go online in order to be able to even be put on a waiting list. Things of this sort made it pretty hard for a lot of people who had been there for 10, 20 years. I had just been there a year, and I'm laying down roots. I'm not looking to move. Then all of a sudden, you got to go. I wasn't ready for that. But the situation escalated, So once I did step out there, I found out there was a lot of things I needed to get to know, so as that if this ever happened to me again, I will know what to do. And in turn, when I did step out there, I found out a lot of other things. A lot of other people was going through the same things I was going through without housing. They had basically clammed up within themselves and said, "Well, this is not worth it." Why would I go from one bad situation to another bad situation, hoping, like I was hoping when I got to James Robertson, to lay down roots. I wasn't going to have to move anymore. You got people who's living at the mission and get funds. They get SSI or they get Social Security, but they find it easier to be at the mission than to go out here and seek housing because of the way it's presented. I can't say exactly what it is for them on a personal basis, but for me, I found that once I was receptive unto that call to come in, and then I found what I found, it did dishearten me, but it didn't stop me. I continued on anyway, regardless of what was set before me. And social services, they came forth, and they stayed with me until something came out of it.
Okay, so you're now housed somewhere else?
Yes.
Okay, awesome.
Amen.
Thank you for sharing your story today. I would like to ask if any of you would like to speak any more about the affordable housing need or know of any other innovative projects that you'd like to talk about regarding affordable housing. This is to all of you. We have about 5 or 6 minutes, I guess, that we can discuss additional affordable housing needs.
I just think that there's one thing that we've got to address as a city, and this is the density issue. I mean, how many of y'all were here 3 weeks ago when they had the MTA meeting? And they were talking about the bus routes kind of in keeping with the Nashville Next plan. Well, one of the things that came out of there is they said the reason we don't have regular bus service, which is critical to this audience, especially you social workers who thank you for what you do, is we don't have enough density in the neighborhoods. So to have a bus run more regularly, you have to have greater density. And that's why it works in Chicago and DC and New York, is the density is so great that they can run that bus every 20 minutes. So the density is also going to be the key with land costing so much. We're going to have to be able to do greater density on a 50 by 150 lot. I mean, if we don't do this, if we don't meet this, we're not going to hit our ability to create more housing at a lower income, at a lower cost. So I just think that one thing that's going to be a real challenge for us, and there's going to be a lot of turnover and a lot of key metropolitan positions in the next several months, but we do want to keep our eyes really focused on how are we going to address density going forward. It's going to be key to you all getting your clients what they need, which is affordable housing along a bus route that provides a regular service so they can get to work.
Yeah, Reverend Barnes.
I think that there are two things that I know of that are very real and very practical and very doable and very political. One is to increase the resources for the Housing Trust Fund. We need more affordable housing, especially for folks who make less than 30% median income. We can do that. The second thing is, in my margins I wrote IZ, inclusionary zoning. It is not simply enough to provide more affordable housing if we're going to pack it into areas of concentrated poverty. That ain't giving the kids a chance. Please, give the children a chance. Decades ago, Montgomery County, Maryland, first IZ that I know of, maybe you know more. It means that developers assume the responsibility by law when there's a development to include what? 4, 6, 7% for affordable housing. They get density bonuses, Eddie, and they get various and sundry perks. But brothers and sisters, if we keep building decent housing and putting it all packed in together to concentrated poverty, we're going to keep raising generations of kids who don't see any kind of models that they want to imitate. So two things, Avi, and work with Avi and the organization to create more resources for affordable housing, Housing Trust Fund. There are over 700 of those in the United States today. Let's make Nashville strong enough to really make an impact. And the other thing is, let's take care of site selection and the avoidance of concentrated poverty. Two things we can do.
Thank you. Okay, so I think we have about 15 or 20 minutes for questions. If anyone has questions, if you'll come down to the mic and the panel can answer. Okay. No questions? Oh, okay, we do.
I have a really quick question. There's a quiz through PBS called How Small is the Bubble You Live In? And it's really fascinating, and I guest lecture some classes at Vanderbilt, and I always have the students do it because one of the theories around why some of the problems you all talked about today exist is because there's a huge disconnect between individuals in America who are middle income and above and the rest of the population that we just can't relate to each other any longer. So it's really interesting. And so my question back to inclusionary zoning is, we seem to have one of two situations that occur in metropolitan areas. We either have a huge flight of individuals who can afford to leave for what they perceive as being safer or quality education or better housing, or we have a huge influx of them coming back because they've decided that now they want to live here and it pushes everyone out. Are there cities across across the country that have implemented policies that have created what you're talking about very successfully, where we have this balance, because what's happening is the people who can afford to leave or who can afford to stay, that's what we end up seeing happening, and everyone else gets left behind. So are there models that we could look at?
Well, Reverend Barnes alluded to Montgomery County, Maryland, which is, as far as I know, the first and most successful inclusionary zoning model in the U.S. And it is county-wide, as far as I know. And I think that helps to address some of the issues that you were asking or talking about, where it helps to distribute and balance that availability of affordable housing wherever new construction, new development occurs. I think that really is one of the strongest assets to the inclusionary zoning concept, is that it can operate wherever. I mean, it depends on how the policy is crafted, but it can operate countywide and more broadly and equitably that way.
Okay. Hi, I'm Nell Levin. I'm with Tennessee Alliance for Progress and also with NOAA. I think one of the best ways to keep people housing affordable is to fix up houses. What are we going to do to keep people in place in the neighborhoods where they have been, many of them, for many, many years, but their house is deteriorating, they can't afford to fix it up? How can we get some resources dedicated to keeping people in the homes that they're already in, which are affordable?
I think Rebuilding Together, I'm not sure if she's here today, but they're doing a lot of good work in that area.
They are. They just did 5 houses in Cleveland Park and McFerrin Park. But, let's look at the big picture. That's 5 houses out of what the need. I mean, I love Rebuilding Together, but they don't have sufficient resources to really deal. I mean, I don't think we're going to deal with this problem unless we get some funding through governmental agencies, as well as trying to, give rebuilding more money. But it's kind of off the radar.
Mm-hmm. Yeah, and I think that's one of the pushes for increasing the Barnes Housing Trust Fund, is being able to be a little bit more flexible in what the use of that fund would be for. So in that case, if you have more funding, you could possibly do housing rehab and repair as well as new construction. Anybody else on the panel have an answer?
Well, I think the key on that, though, Nell, is just the repayment. I mean, you brought that up, is that the banks, I know, over the last 20 years have periodically done rehab loans, low-interest rehab loans, but they get no business. And so the trick is they don't get enough to keep it going. Anyway, the trick is the repayment model, but with the grants being cut, we probably ought to just put heads together and figure out if there's some other way to structure financing so that it can work through the existing bank systems as far as the volume goes. I forgot who brought up volume, but as far as that goes.
Or a revolving loan fund, maybe administered by the housing fund, that would be funded initially by infusion of money from Metro via the Barnes Affordable Housing Trust Fund. That could work.
Okay.
Hi, I'm Kay Bowers with New Level CDC. And I know one of our challenges in our world is sometimes we get stuck in our silos and we go up and down like this, like pistons, and we don't connect with each other. And because one of the services that our agency does is housing counseling, we get lots and lots of calls for people with housing needs. And particularly families with housing needs, and particularly families with children in school with housing needs. So Metro Public Schools has a program called the HEROES program, which we've made it our business to learn how that program operates and how they help those families in crisis, to help those kids in crisis. But I wondered, maybe this question maybe should be directed to Jan, is do you all connect in some way with Metro Public Schools, or does Metro Public Schools staff reach out to you so that you all can link together to figure out how to leverage what you all have? And many times, the HEROES program, then they circle right back to us. And we're playing a role again. So we try to be resourceful to direct people in ways that they can help at that point in time with that particular crisis, and then plant the seeds for them to think about next steps once they're kind of stable for a while. But I'm interested to hear about those connections, not just with Metro Social Services, but also with Metro Public Schools, so that we can address those families. Thanks.
And I think you bring up a really good point that when people are not stable, when they have an emergency need, they can't think about what that next step is. And that really does create a block for them. If I don't know if my water is going to run, that's going to be at the front of my mind. Getting to that next step in life is going to be really challenging. But to address the specific question, the link part of our name is really trying to connect people with the other resources and to make connections from other programs into ours. So for us, personally, we take referrals from HERO. We work with the counselors at Catholic Charities, and we place priority on helping those families. And we also, when we learn of families that are experiencing homelessness, we refer them to ask their counselors about that program. I think always deepening the ties between organizations and between community agencies can really benefit our clients. So I'd love to talk to you about how maybe the three of us can get together as well, or if you want to be included in the larger financial assistance coalition, how that might play out as well.
So this is as much a statement as it is more of a statement than a question. And that is just a reminder to all of us that when we have these conversations and we see the evidence of why we need public policy change and behavioral change, when we see the evidence, what do we do after we look at the evidence? And one of the things we all can do is raise our voice. In my lifetime, I have never seen major public policy change without the outcry of the public. And right now, the two recommendations that Reverend Barnes has put out for us, deepening the trust fund so that it can do the things that Nell is talking about, and to provide more opportunities and inclusionary zoning. And as Brett said, it's not just inclusionary zoning, it's county-wide mandatory inclusionary zoning. And both of those things are going to be put on the plate of the City Council this spring. And what will happen is there'll be naysayers raising their hands and saying, don't do either, particularly zoning. And the developers will come forth, and the people worried about their neighborhoods will come forth, and if the rest of us stay quiet, those are the voices that will be heard by those who ultimately will have to raise their hand on policy change. So I'm just making an appeal to all of you. You have NOAA out there, but it's really an organization of churches and synagogues. A Voice is an organization of individuals like each of you. And I'm encouraging you to join A Voice so that when we need to email you, to call and make visits, that you will do more than just listen to this information. And I'm talking to activists, so I'm just begging you all to join our work.
Hi, my name is Carter Abel, and I work with Ephesus House. We do transitional housing for ex-offenders and men coming out of incarceration with substance abuse issues. And one of the issues that we face are we work with special populations that have extra barriers to finding affordable housing based on their criminal history or substance abuse histories. And so I'm wondering how, in the kind of conversation to develop more affordable housing, people with special populations with additional housing barriers are being taken into account?
That's a good question. We are very sensitive to that need. As I mentioned earlier, we try to, where we can, address the most critically unmet housing needs. And certainly ex-offender housing or reentry type housing is one of the greatest needs in Nashville, I would think, or anywhere. And it's definitely something that we look at very carefully with how we structure our leasing process and our application review process. Not all of our properties operate the same, but we definitely try to make most of our properties at least available to folks without a long record. Some folks who have a long record, it is tougher to get housing anywhere, and that's even including urban housing solutions. We actually do have to draw a line somewhere because we have to preserve the overall stability of the community, and based on our 24 years of experience, we have to make some tough decisions, and that's one of the areas where we are still open to reviewing our policy, but there is a threshold beyond which we wouldn't really allow somebody with a long record, probably, especially a recent record, if it's long, to maybe be eligible to move in. But that need for ex-offenders reentering society, needing that first step and to rebuild their lives is so important. And it is something that needs to be continually addressed, or not addressed, but discussed in shaping policy or as agencies work to try to address the issue. It is a significant issue, and so it's a good question to raise.
Anyone else on the panel? Okay, we have about 5 or 6 minutes for questions, so if you have a question, come on down.
Hi, Keith Branson. I'm director of Westminster Home Connection. We grew out of the flood, 2010. Not that well known right now, and in one way that's okay because there's a lot of need. But our main focus coming out of the flood with grant money that came right at that time helped us shape our work for seniors who are homeowners, low income, and doing critical home repair and then mobility modifications. So what was mentioned earlier about rebuilding together and rebuilding Nashville, we're in that zone, that niche of trying to help do repairs for people who are in their home. And we do referral responses from partner agencies like 54's Living at Home. So I've been sitting here trying to frame a question. And I know that from the flood and what Nashville's capable of, that a community groundswell of support, like was mentioned earlier, of the faith community and individuals coming together, people who can grab a saw and a hammer and even help sort, pack, and move, can be a big part of this solution. And I guess my question is coming somewhere to how do we better create the crisis that's already here, but in an awareness way? Funding models that we can look at for rotating funds, activating other ways of zoning and political and legislative policy. Those are all good pieces of it. But I guess I would like to know how and where we can sit at the table with the right people as Home Connection work and others to look at how we're helping people stay in the home they're in a little longer, and that in itself help alleviate some of the temptation to sell out to a check that's given to them that says, hey, we'll give you a lot of money for your home, but then where do they go? So I'm not sure my question, except is there a place that can fit into this affordable housing conversation that's dealing with the repairs involving individuals, churches, other groups that want to come together and do things in their own neighborhood, to be a good neighbor? And I guess part of this comes from my own background. I grew up with Habitat for Humanity in the 80s when it was a young thing that no one knew. They thought it was a part of was that for animals? Habitat for what? Now it's a household word. And it was a movement. And it was based on a dream to eliminate poverty housing. And I sense a need for that energy in Nashville that says, as Reverend Barnes had said, that we want everyone to be in a decent place and a decent community. So it's not a very specific question. Maybe you can help me with a way we can band better together with the community and involve them.
Okay.
Well, I will say, I think it's, were you about to answer? Okay.
Well, you could answer that probably.
Well, I was just going to mention the two organizations that I guess have been mentioned quite often during this period is a Voice for the Reduction of Poverty and NOAA. And we have several representatives from each one of those here that maybe they can come up afterwards. I don't know. It sounds like you're going to have a flock of people. But there's also a meeting that has been going on for decades called the Affordable Housing and Community Growth Forum that meets monthly, that has different people that come to the table to discuss affordable housing needs as well as community development needs. And I can get you more information about that, but we meet the second Thursdays of each month. It's a great resource, and that's usually where a lot of people patch into where the other resources are. Did you want to add anything, Eddie, Brent? Okay.
Well, the bottom line is that I think that what you bring up is there's not a place to come together for putting product on the ground. I mean, I think that we've done a great job expressing the dissatisfaction and the need. But there is not I think the Low-Income Housing Forum, but you said the right name, is maybe a good starting point as far as that is. But we do, I think you point out a need. It wouldn't hurt to get us all together. Where's provisions? Where can we get stuff going? Who can we work with? That kind of thing.
I'd like to thank our wonderful moderator and panelists and the presenters. I would like to thank Metro Channel 3 for videotaping this, so it will be on YouTube. So if you missed something and want to watch it a few more times, it will be available for you. Please go ahead and turn in your participant evaluation form as you go out. And we thank you again for coming, and continue to check our website. We don't just do information once a year. We continue to update and add. So thank you.